And I tell women this all the time too. I mean, with just the breast lift, if a woman comes in and she's a double D and I just do a lift, her back and shoulder straps and all that are going to feel better anyway. But if they are too large, we will remove more and make them a prettier breast. So you're not removing the breast. It's not like a cancer operation. I mean, our goal is to make a prettier breast as well with a more controllable size.
And you do that. My husband loves me in T-shirts. Was that too much to say on the podcast?
Absolutely not.
Welcome to Plasticos, the everything you ever wanted to know plastic surgery podcast with me, Dr. Christopher Park, and host Kym Anderson. We will discuss surgical and non-surgical plastic surgery options and the ways that they improve your health, mood, personality, and success.
Welcome back to this podcast of Plasticos. I'm joined with Dr. Christopher Park, a board-certified plastic surgeon here in Mobile, Alabama. Let's talk today about the most popular plastic surgery procedure that you do in your office. And you were saying that's breast surgery, and there's so many different types.
Yeah, I do everything all over the body, but if you kind of lump it all together, I spend more than half my life on the breast. There's a variety of ways to get there. I mean, there's cosmetic breast surgery, implants and lifts. Mm-hmm. There's kind of the breast reductions, which can be considered medically necessary and sometimes covered by insurance. And then you have breast reconstruction, after cancer in women. And then there's even male breast surgery.
Think about the most popular one. Let's hit on that first, and that's the breast implants.
Yeah, people like talking about breast implants more than anything. I mean, a lot of the other ones are a little bit less exciting, I guess, to patients or to the general community. Yeah, I mean, breast augmentation is a very common procedure, and it's an amazing procedure. We are blessed not only to have good surgical technique, and I'm very confident in my own skills, but we have better implants than we've ever had in the last 10 years or so, and of numerous sizes, shapes, profiles, different textures. It's amazing what we have and how we can kind of customize it, and that's why it's not, one size fits all at breast implant.
So long gone are the days where I know people were real scared of breast implants because there was one that leaked, but those are all not even on the market anymore.
So there are different types of implants, and there's really 5 types. There's saline implants, that are silicone shell filled up with salt water. There's 3 different types of silicone that go from soft, medium to the firmest. They're all cohesive is the term we use. I'll explain that in a minute. And then the 5th one is there's a new implant called Ideal Implant, which is a saline implant with a bunch of little tiny saline shells trying to make it feel like silicone. Long and short of it is silicone implants feel better than saline.
Okay.
They're going to be smoother. You're not going to feel the edges or ripples as much. The silicone implants made initially, starting in the 70s and into the 80s and pulled from the market in the 90s, were silicone, but they were a pure liquid silicone. I always tell people it's kind of like vegetable oil. And you could have a tiny hole, or it could even seep through the surface of the implant. It never actually popped, but because that silicone was so liquidy, it just went through with kind of like osmosis. So those implants had a lot more issues. Okay. When I said cohesive earlier, cohesive means those implants on a chemical level want to stick together. And the softest implants do it a medium, a little bit, and the medium and then the firmest really stick together. The firmest, you can cut them in half. They're still not going to leak. I mean, they are solid. And so those new implants are all much better. They're much less likely to leak and much less likely to leach, kind of the osmosis thing I talked about. So patients have a lot fewer problems. They were not made very well back then. And it's kind of a good thing they got pulled from the market. But they were pulled from the market not for that. They were pulled from the market from honestly, kind of some bad press. A few women had breast implants and then developed autoimmune disease, and Connie Chung had a special, I think it was in 1992, and that led to this big uproar, but it really didn't have much scientific basis. But the FDA pulled it, a lot of research done. If you really look at the numbers, the risks of autoimmune disease are not higher in patients with breast implants than the general population. So it seems to be more a coincidence that they developed lupus or whatever 6 months after the breast implants, because based on other 30-year-olds, they were in the same right percentage. There are some women now that do, report breast implant illness, which is getting a little more traction, and we pay dire attention to it. There are certain women that just body may not agree with having a breast implant in them. And some of it may be cerebral and some of it may be physical. There are certain women that just don't feel right after having breast implants in their mind. And if I ever have a patient with that, we can just take them out.
So they're not hard to take out at all once you get them in?
No, not unless they've ruptured. And again, the modern implants don't rupture very much.
Now, how do you know what size to get? Is there a certain guideline? Because some people come in and they say, you know what, we want them just triple the size or just, what is that guideline? I
pride myself on talking to people about that and trying to figure it out. I kind of let people talk at first, ask them a few questions, and I try to get a general feel for them. Ultimately, I'm going to make a range of recommendations that are all going to look good. I'm not going to pick one that's ever going to be too small or way too big, and they can kind of pick in there their flavor. We help them with that. If some people want me to pick everything, and I will. Other people, we've got a sizing system in the office. We've even used computer-generated images. They're not great, but to help people decide. Other people, the old school answer, to answer your question, is get a bag of rice at home and a graduated cylinder and put in 100 cc's, 200 cc's, 300 cc's, do it in your own privacy and figure out what you think you want. But that doesn't happen very much anymore. I mean, I advise people. And if I get people that want to go outside my range, too small or too big, we talk extensively. Usually I'm right, and we realize that through the process. But I mean, we don't force people to do anything. And I've had plenty of people that went less than I said and came back and ended up going larger. If somebody wants to go crazy large, sometimes I'll just tell them I'm not their guy. If they're trying to be, some of these ridiculous images you see on the internet. I'm not afraid to say that at all. I mean, I'm not going to do something that just destroys the tissues in the skin.
Yeah. So there is not necessarily an ideal size. It just depends on the person.
It absolutely depends on the person, what they want. I tell everybody my goal is to make you happy. So the first thing I do is listen, because I'm not trying to make breasts that I'm going to like the way they look. That doesn't do me any good if you're not happy. So I view that as my responsibility. So that's why consultations are not super brief. I try to translate what they're saying and put it into numbers because it's complicated. There's a lot of implant options.
I see. Now, what about the recovery time for someone who wants to get an implant?
So for a straight-up breast implant surgery, it's actually pretty quick. We usually go into the muscle. Sometimes we don't. We discuss that with each patient. But when you go into the muscle, it's the equivalent of partially tearing your muscle, which anybody that's ever done that knows it hurts acutely for a few days because we release part of the muscle. The pectoralis major muscle is the muscle we're talking about. It lays flat on your chest. It doesn't cover your entire breast, but it covers about 2/3 of it. And you have to release the bottom third of it to let it open up so that implant will sit in there the way it's supposed to. So you essentially tore that third, or I tore it for you. And that takes a few days of acute pain, and then usually you're kind of over it. Most people are off pain medicine in 2 or 3 days and getting back to normal. And we tell you not to lift much for about 2 weeks, over like 10 pounds, just so you don't accidentally tear a little bit more of the muscle. And after that, you can do whatever you want.
So that's not a long downtime at all.
No, it's really not.
All right, now let's talk about breast reduction. Okay. Because just the opposite of implant, you've got women who are very large who come in and they want a breast reduction. I came in, you did a breast reduction for me. It's fairly easy. It's fairly easy.
It is. The beauty of a breast reduction is it's a breast lift as well. So if a woman happens to have a large enough breast, then we can do a breast reduction with a breast lift. We're going to make a prettier shape and give you the volume where you want it. It's not truly the opposite of a breast implant because an implant gives you volume in the upper pole. So in most women with a breast reduction, the breast is droopy and hanging low, and that weight is down low, and it's putting torque and pain in their back and their bra straps. They're digging into their shoulders. And I tell women this all the time too. I mean, with just the breast lift, if a woman comes in and she's a double D and I just do a lift, her back and shoulder straps and all that are going to feel better anyway. But if they are, too large, we will remove more and make them a prettier breast. So you're not removing the breast. It's not like a cancer operation. I mean, our goal is to make a prettier breast as well with a more controllable size.
And you do that. My husband loves me in T-shirts. Was that too much to say on a podcast?
Absolutely not.
Now, that's part two. You can put that part of what you call that mommy lift that we were talking about for doing a lift because you have children and your breasts go south.
Correct. To really make it simple, the lift tightens everything up and puts the nipple where it's supposed to be. A reduction would be removing volume, and then an implant's going to be adding volume. But the volume we add with an implant is usually in the upper portion of the breast. So there are actually patients out there that need a breast reduction and an implant.
Really?
Yeah, because the breast reduction portion is that low gravity hanging portion down on their stomach, but they're still very flat up top. So sometimes we need both.
I didn't even know that you could do both like that.
Yep.
Now, what's the recovery time on that?
So breast reduction, you don't have to necessarily cut the pain. So you don't have that acute pain like we talked about with breast augmentation, but it takes longer to heal. Everything's pulled tight. We move a lot of things around, and we almost always do some liposuction with it. And those things are going to stay sore. So I say the acute pain is less, but it lasts longer, about 2 or 3 weeks.
Now, that's something that a lot of people, I'm sure, are going to ask, because you think about breast reduction and people being so heavy, and you talk about the weight on the bra and the neck. Does insurance cover that? It
can if it is enough, and that requires a consultation and me to kind of determine it. Not every insurance company is the same. We usually have to take off at about 500 grams a side, so at least a pound per breast, which is more tissue than a lot of people think it is. And that's not universally true, but if you wanted to just throw a number out there, that 500 grams per side, which I decide when I'm examining you with my own 2 hands, if I take off 500 grams or more, what's it going to look like? Is this patient still going to be happy? And there are certain patients that need breast reduction and they get approved by insurance very often. And then there are certain patients that, don't meet insurance criteria, but they still get the benefit of the relief.
And what about the breast implants? Because I don't think we talked about the insurance with that.
Yeah, breast implants for unless you've had a mastectomy for a medically necessary reason such as cancer, it's not covered. And there even was a period of time in the 70s and 80s when women had mastectomies for painful breasts, which we don't do anymore. And sometimes their surgery back then was covered by insurance, but not anymore.
Now, you talk about the whole reconstruction when you talk about breast cancer. Let's talk about that and how that works and the confidence it brings back to women who have gone through cancer.
Yeah, breast reconstruction is a passion of mine. It is a totally different, conversation. It's a variety of options. Long and short of it, which we probably need a whole podcast to get into, is we are trying to give a woman a breast back or breasts. And, hopefully better even than their breasts they had before they were diagnosed. Not always the case if somebody has beautiful breasts to begin with. But a lot of times, we can make them actually look better. Now, they're not going to be your exact breasts, and they're going to have some scars, and they're going to have some numbness and those sorts of things if you've had a mastectomy. But the changes you can see in patients are amazing. You see it more in the delayed reconstructions, meaning they did not do reconstruction immediately, so they lived a period of time without a breast. And some women are okay with that. And there's prosthetics out there, but some women are not. And there's been a lot of women who just really finally became themselves again, got over the grief of their cancer or the anger at their cancer when you can kind of give it back to them.
And that, too, is a long consultation.
It is.
That is covered by insurance.
We barely skim the surface of that one right there. It's and there's a variety of techniques. We don't always do it with implants. Sometimes we use your own tissue and move it from one place to another. It's a complicated process.
Now, men don't realize that they can have implants as well. That's something that we talked about. They just don't think that's only something that women do with breasts, but you can do that with men pecs.
Right. So male breast surgery, to me, would include people who have large breasts, either from being overweight or true gynecomastia, which is female type of breast tissue in a man. And then there's men who just wish their pec was fuller. You'll see it from a purely cosmetic basis. You'll also see it, some people are born with underdeveloped muscle, like Poland syndrome. And we see people with chest wall deformities called pectus excavatum that sometimes pec implants can help hide those sorts of things. So it's one of those things that people need to realize there are options. If it's something that bothers them, talk to somebody or get on a podcast or the internet and see if there's something that can be done.
Now, we've talked about, like with women, and you do liposuction and breast surgeries and things like that. You also have to be realistic and realize that you still have a certain lifestyle that you have to live as far as, exercising and eating right. Is that the same with a man when you talk about having breast surgery for him? Because, some men may come in and think, oh, you know what, I can do this breast implant and not have to get on the chest machine at the gym ever again.
You still need to be in shape. Yes, the pec implants are nice, but I view them more to fix patients with an obvious deficiency than just an enhancement. You can do that, but it's a little bit different.
And something interesting you said, too, about when you get up to a certain age as a man, that testosterone starts decreasing, the estrogen starts increasing, and men who are older, they're a good candidate for this type of surgery.
Yeah, there's a lot of men that start to develop more breast tissue as they get older because testosterone is converted to estrogen and the breast will truly enlarge and it can be addressed. If it's mild to moderate, liposuction alone, 2 little tiny 4 millimeter incisions may be all that they need. If you wait too long or if it's more severe, then we may have to remove some skin and actually make some incisions. But it's just one of those things that people need to know as an option, because a lot of people have no idea, but they're very bothered by it. They haven't taken their shirt off in years. I mean, people like to joke about Hollywood and those sorts of things and think that plastic surgery is this superficial thing, but I get a lot of hugs around the neck, and I've had hugs around the neck from 65-year-old men who said they've been embarrassed by their chest for 50 years and just finally realized they could do something about it. And I mean, I've had them tear up in the office. I mean, those are the reasons I love what I do.
And that's what a lot of people have to realize, that it's not a superficial thing. It's a matter of giving you back that self-esteem, that self-confidence that you may have lost with certain areas of your body that can be fixed. And that's so important. Now, we've hit on breast implants. We've hit on the breast reduction, the cancer, and the men's breast. Any other type of breast procedures?
Well, we left off breast lift. So similar to breast reduction, usually. I mean, not all breast reductions need a lift, but almost all. So breast lift is when things have gotten floppy or droopy, and they need to be tightened up. If there's overhang, you can get moisture and skin breakdown below the breast, or you may just not like the way they look. Breast lift's an awesome procedure. If you have a decent amount of your own breast tissue, that may be all that you need. If it's truly what I call deflational ptosis, which ptosis is droopiness of the breast, and deflation means it's from hormonal change or pregnancies, you may actually need an implant as well to give you the shape, and then we kind of tighten the skin up all around it. But that's the simple way of thinking about it, is a breast lift is how we tighten it all up. And then if we want fullness, we add an implant or fat grafting to that.
Can you do the procedure along with other procedures at the same time? Because we don't have a lot of time here left, but I'm sure you get asked that question a lot. All
the time. I mean, and in my opinion, it's a good thing to do if you can combine a safe amount of surgery together. My goal is never to operate on a patient for more than 4 to 5 hours. Most surgeries I do, in general, take an hour and a half to 2 hours. So usually you can squeeze 2 together, and that's very, very common. Breast and abdomen are addressed together very often because they're close to each other. They're easy to take care of, both of them. So that time that you've asked a friend or family member to help you with things, it's easy to do both.
Recovery and all at the same time.
Absolutely.
And does it add any more days to your recovery?
No, the longest procedure is going to be the linchpin, and then anything that's shorter is just part of the process. So like if you do a tummy tuck with muscle work, that's a longer recovery than doing a breast lift. So the breast lift is just kind of, you sneak it in there. Sneak it in on your own brain.
Won't even really feel it too much.
Right.
All right. Thank you so much, Dr. Park. And before we wrap up this podcast again, can we have an email address, your web address, and phone number for people who want to get in touch with you?
Sure. They can email the website at info@mprsd.com or me at drpark@mprsd.com. The website is mprsd.com, and phone numbers 251-340-6600.
All right. Thank you so much.
Thank you.
Thanks for listening to Plasticos Podcast. Please follow us on our Facebook page, and please rate and review Plasticos on iTunes and anywhere else you get your podcasts. This really helps others discover this show. Have a plastic surgery question you want us to talk about? Contact us on our Facebook page or email me at drpark@mprsd.com. That's drpark@mprsd.com. Plus, we really want to hear what you think about our episodes, so let us know. Thanks again for listening, and remember, insist on credentials, invest in results.